All right, so let's talk about the gluteal region. So by the end of this discussion, you should be able to describe the boundaries of the gluteal region. You should be able to describe the muscles of the gluteal region, their actions and nerve supply. You should also be able to describe the origin and course of the vessels and nerves within the gluteal region. So looking at the gluteal region, this is one of the regions of the lower limb that stretches from the iliac crest, right, to the gluteal fold. So this is the gluteal region, right? And the two regions basically, so this region is basically divided into two subregions that are then divided by this lateral cleft, all right? So looking at the gluteal region, the cutaneous supply of the gluteal region comes from several nerves, and I shall explain these nerves in this way. We shall divide the gluteal region into quadrants, right? We shall divide the gluteal region into quadrants. Right? So we have an upper lateral quadrant, right? So let me actually put it this way. Okay. So we have an upper outer quadrant, right? Or upper lateral quadrant, which is supplied by T12 and L1. So the upper outer quadrant is supplied by the 12th thoracic nerve as well as the iliohypogastric nerve. The lower lateral quadrant is supplied by the lateral cutaneous nerve of the thigh. So the lower lateral quadrant is then supplied by the lateral cutaneous nerve of the thigh. We're done with the lateral quadrants. Going on to the medial quadrants, the lower medial quadrant is supplied by the posterior cutaneous nerve of the thigh. So remember, the posterior cutaneous nerve of the thigh also supplies the posterior surface of the labia majora as well as the scrotum. The upper medial quadrant is supplied by the posterior rami of the upper three lumbar, so that's L1 to L3, as well as the posterior rami of the upper three sacral nerves. So remember, this is continuation with the back, and the back is basically supplied by the posterior rami. So that being continuation of the back, that's why here we have the upper three lumbar, upper three sacral being the posterior rami. Remember, this region is in association with the iliac region, right? That's why we have supply from the iliohypogastric as well as the 12th thoracic nerve. This region continues with the lateral cutaneous area of the thigh. So this region is then supplied by the lateral cutaneous nerve of the thigh. This region is continuing with the posterior cutaneous nerve, posterior cutaneous area of the thigh. So hence supplied by the posterior cutaneous nerve of the thigh, right? So to revise that, let's put it in this way, right? So for quadrants, we have the upper lateral quadrant or the upper outer quadrant, which is supplied by T12 and L1. Then we have the lower lateral quadrant, which is supplied by the lateral cutaneous nerve of the thigh. Makes sense. Then we have a lower medial quadrant, which is supplied by the posterior cutaneous nerve of the thigh. Then we have an upper medial quadrant, right, which is supplied by the posterior rami of L1 to L3, S1 to S3. All right. So the fascia of the gluteal region, we basically have got two types of fascia, the superficial and the deep one. The superficial fascia of the gluteal region is basically thick and forms the prominence of the back of the buttock, and most prominent in females. So there is much fat that is stored in that region. Then of interest is the deep fascia, right, which is the fascia lata of the lower limb. So the deep fascia of the gluteal region attaches on the margins actually of the iliac crest. And also the deep fascia of the gluteal region, which is the fascia lata, encloses the gluteus maximus and then covers the outer surfaces of the gluteus medius. And looking at that, we then see that this deep fascia as well, which is the fascia lata, after enclosing the gluteus maximus, it will also form a sheath around the muscle that we call the tensor fascia lata. Right, the tensor fascia lata. Are we together? Then there will be a thickening of deep fascia actually, right, from the iliac prominence, right, to the tibia, right, which is called the iliotibial tract, right, which is called the iliotibial tract. So from the iliac tuberosity down towards the tibia, that is called the thickening of the fascia lata, which is then called the iliotibial tract. So the iliotibial tract also acts as an attachment. So that's the deep fascia. So here in this picture, we can appreciate the gluteus maximus, the gluteus medius, and the tensor fascia lata that I say is included within the iliotibial tract. So the deep fascia will thicken at this point and form this tract that goes onto the tibia from the ilium, right? And this is the tensor fascia lata, which forms a sheath around the lower limb. And the superficial muscles in the gluteal region, we have the gluteus maximus, gluteus medius, gluteus minimus, and the tensor fascia lata, right? So let's start with the gluteus maximus. So looking at the gluteus maximus, its origin is basically from the outer surfaces of the ilium, the sacrum, the coccyx, the sacrotuberous ligament. So it's coming from the outer surface of the ilium, the sacrum, the coccyx, and the sacrotuberous ligament. And then of its insertion, a greater part of it actually inserts on the iliotibial tract. So the greater part of it inserts on the iliotibial tract, and then another part will insert on the gluteal tuberosity on the femur. That is the gluteus maximus. Then the nerve supply of the gluteus maximus comes from the inferior gluteal nerve. So the nerve supply comes from the inferior gluteal nerve. So looking at the gluteal region, I want you to appreciate these lines that we have at this point. So here we have origin of the gluteal muscles. So these lines, we have the posterior gluteal line, right? The medial gluteal line, and the inferior gluteal line. So please note that the gluteus maximus originates posterior to the posterior gluteal line, the gluteus medius between the two lines, and then the gluteus minimus between these two lines. All right. And this is the area of origin of the gluteus maximus, as also on the sacrum and the coccyx. And we said its insertion will be on the gluteal tuberosity, right? On the gluteal tuberosity of the femur, and the greater part goes on with the iliotibial tract. So other gluteal muscles, we have the gluteus medius at this point, and covering the gluteus medius will actually be covering the gluteus minimus, and these two muscles will be going to the greater trochanter of the femur. Will be going to the greater trochanter of the femur. So talking about the gluteus medius, it comes from the outer surface of the ilium, and then actually goes and inserts on the lateral surface of the greater trochanter of the femur. So if you can get, it goes on the greater trochanter of the femur. Nerve supply to the gluteus medius is the superior gluteal nerve. The gluteus minimus is coming also from the outer surface of the ilium, and also then goes on the greater trochanter of the femur. And then the nerve supply is the superior gluteal nerve. So these are given by the superior gluteal nerve, the gluteus maximus by the inferior gluteal nerve. Appreciating this muscle, which is the piriformis that divides the greater sciatic foramen into an upper compartment and lower compartment, is the piriformis muscle. The piriformis muscle, right, coming from the anterior surface of the sacrum, so we can actually call the anterolateral surface of the sacrum, up to the greater trochanter as well, is supplied by the sacral nerves, right? And then also to appreciate, we have the obturator internus muscle. So looking at the obturator internus, coming from the obturator foramen at that point, right? The obturator internus muscle is coming from the inner surface of the obturator membrane, and then it's attaching as well on the greater trochanter. So we see the common thing there is the greater trochanter. So there's no need for you to train, right? Then we have what we call the gamellae muscles. So we have the gamellae superior and the gamellae inferior muscles. So to help you there, remember the ilium has a spine and a tuberosity at this point. So you have a spine and a tuberosity. So spine and tuberosity. The gamellae superior comes from the spine. The gamellae inferior comes from the tuberosity. And they also go on the greater trochanter. That's how we make life easy. Then lastly, we talk about the quadratus femoris. Quadratus femoris is coming also from the tuberosity as well, from the ischial tuberosity, also going on a line, right, which is generally on the greater trochanter as well of the femur, right? And this is basically below, a little part below the greater trochanter of the femur. So we call that the quadrate tubercle at this point, right? So the common point is the greater trochanter, and for this guy, just below on the quadrate tubercle. And to also help you there, the sacral nerves that supply these small muscles at this point are given names, right? So the nerve supply to the quadratus femoris is the same nerve supply that will also supply the gemella inferior, right? So we can give that the name IQ. So the nerve supply to the quadratus femoris, or the nerve to the quadratus femoris, also supplies the inferior gemella. Why? Because look at them, they have a common point of origin. What about the gemellae superior? The gemellae superior is on the ischial spine, right? The gemellae superior is on the ischial spine. And this obturator internus as well has a part that comes towards the ischial spine. So the gemellae superior is given by the nerve supply to the quadratus, to the obturator internus. So nerve supply to the obturator internus. Are we together? Now let's look at the activity of these muscles. So I'll be starting by the gluteus maximus. Looking at the gluteus maximus, coming from this part, going to the gluteal tuberosity, and also having an attachment on the iliotibial tract, we see that the gluteus maximus actually extends, right? It extends and laterally rotates the hip joint. So it does extension and lateral rotation of the hip joint, number one. Number two, by its action through the iliotibial tract, it also extends the knee joint. Looking at the gluteus medius, the gluteus medius are basically abducts, right? So number one, it basically abducts the thigh, right? So because of where it's coming from, the upper region, and attachment at this point. So when it pulls that way, it basically abducts, right? And also tilts the opposite pelvis, right? So it does abduction and also has tilt the opposite pelvis, right? And then we also see that that is very helpful in clearing the ground from the opposite side of the body. And we see that damage to this muscle or paralysis of this muscle will lead to the positive Trendelenburg sign. Then the gluteus minimus. The gluteus minimus does almost the same as the gluteus medius. So it abducts the thigh at the hip joint, tilts the pelvis, right, of the opposite side to clear the ground. So clearing of the ground is done on the opposite side, and damage to that leads onto the Trendelenburg sign. And the tensor fascia lata basically assists with the gluteus maximus in extending the knee joint. Then looking at the quadratus femoris, the quadratus femoris is basically a lateral rotator of the hip joint. So these other small guys, these ones, are basically doing lateral rotation, right? So these ones are basically lateral rotators because of where they're coming from, attaching to that point. So when they pull, they do that, lateral rotation. Are we together? So allow me at this point to talk a little bit about tilting of the pelvis. So if this is the pelvis, that is the pelvis. And at this point, we have the femur attaching, right? And at this point, we have the femur attaching, right? So looking at these muscles, you appreciate that if gluteus medius and minimus of one side originating from there and inserting on that part, right? When you wanna walk and you wanna lift this leg up, that means you have to tilt the pelvis, right? You have to tilt the pelvis in this direction to this side. So this part has to go up. So that is clearing the ground at this point, so you can lift up this leg. That is done if you fix this leg, right? And then there's contraction of the gluteus medius and the minimus. So that will lead to the origin coming towards the insertion. Funny, right? So the origin will be coming towards the insertion, and that tilts the pelvis towards that side. And damage to that is linked to the sinking of the pelvis of the opposite side, and that is the positive trendolimbic sign. Right? And looking at the ligaments of the gluteal region, with the sacrospinous ligament, right, which is a bit weaker, that's coming from the sacrum to the spinous process of the ischium, then the sacrotuberous, which is a bit stronger and also acts as an origin for the gluteus maximus. And these ligaments also then help us in forming the greater and lesser sciatic foramina. And let's understand the structures that pass through these foramina. So passing through the greater sciatic foramina, we have the piriformis muscle that we say divides this foramina into two compartments, an upper and a lower compartment. We have the sciatic nerve passing through the lower part. We have the posterior cutaneous nerve of the thigh. We have the superior and inferior gluteal nerves, and the superior gluteal nerve passing on the superior compartment, the inferior passing on the lower compartment. We have nerves to the obtusa internus and quadratus femoris. We have the pudendal nerve. We have the superior and inferior gluteal arteries, and the superior gluteal arteries passing on the superior compartment. Then we have the internal pudendal artery and vein. And one thing you must note, if the sciatic nerve divides within the pelvis, its common peroneal branch normally passes on the upper compartment. Then on the lesser sciatic foramina, this is now in relation with the perineum. We see we have the tendon of the obtusa internus muscle, 1. 2, we have the nerve supplied to the obtusa internus muscle, that muscle as well, it's nerve. Then we have the pudendal nerve and the internal pudendal vessels. So take note, the pudendal nerve doesn't have an internal and external, but actually the blood vessels have an internal and an external. In the gluteal region, the vessels have the superior gluteal artery and vein, and then the inferior gluteal artery and vein. These now being branches of the internal iliac artery, as well as the vein. Then the nerve supply with the sciatic nerve, the posterior cutaneous nerve of the thigh, the superior gluteal nerve, and inferior, and we say the superior gluteal passes within the superior compartment. Then we have the nerve to the quadratus femoris. And we talked of the structure supplied by the quadratus femoris. Remember the IQ, right? So the deep muscles, we have the piriformis that we talked about, the obtusa internus, the gemella superior, the gemella inferior, and the quadratus femoris. And I say the nerve supply to the quadratus femoris is the same nerve supply to the gemella inferior. Nerve supply to the obtusa internus is same nerve supply to the gemella superior. Are we together? And these act as lateral rotators of the hip joint. So these muscles that we talk about, right? Then let me now talk about these anastomosis that we find around the femur, the proximal part of the femur. So we have an anastomosis that's called the trochanteric anastomosis. So this provides the main supply basically to the head of the femur. That's why we have to talk about it. And you then need to understand the arteries that take part in forming this anastomosis. So to make it simple, you have the superior gluteal artery, the inferior gluteal artery, the medial and lateral circumflex arteries. So just get that. Superior gluteal, inferior gluteal, the medial femoral circumflex, and then the lateral femoral circumflex. Right? So these are being formed around trochanterus. Now let me talk about this one, the cruciate anastomosis, which is lower, right? So this is basically at a level of the lesser trochanter, right? And basically together with the trochanteric anastomosis, this provides enough blood supply as well, right, to the head, and also forms a connection that is between the vessels of the internal iliac, remember the gluteal, and also as the femoral arteries. So that provides an anastomosis. So that being that, then it's very important also to understand the vessels taking part. So what you do is that you have to delete the first superior vessel, which is this one. So we remove, for the cruciate, remove the superior gluteal artery, and then the inferior gluteal artery is there, medial, lateral is there. Then we add the first perforating branch, of the profunda femoral artery, right? So looking at that, we have the inferior gluteal artery, the medial femoral, the lateral femoral, right? Remember, we just deleted the superior gluteal, and then now we are adding what? The first perforating artery, which is the branch of the profunda artery. Are we together, right? The branch of the femoral artery. So that is basically what you then need to know concerning the gluteal region. I hope that was really good. I hope you get that. All right.